How can a relapse guide future disease management? Imagine a sudden flare of symptoms like weakness, numbness, or vision changes that last for at least a day. That is a relapse, and it actually provides valuable clues about how the disease is behaving. When a relapse occurs, doctors look closely at what happened to understand the disease better and plan the best way forward. Each relapse reveals how active the disease is, how well current treatments are working, and whether adjustments are needed. If a person has frequent or severe relapses, especially ones that leave lasting disability or don't fully recover, it suggests the disease might be more aggressive. This information helps doctors decide if they should escalate treatment or switch to stronger disease-modifying therapies to better control inflammation and prevent future relapses. It also helps in assessing the overall severity of the disease and whether it's progressing from a relapsing-remitting form to a secondary progressive stage. Relapses are usually treated with high doses of corticosteroids to reduce inflammation and shorten symptoms. But if symptoms don't improve as expected, or if the relapse is particularly severe, additional treatments like plasma exchange might be considered. When a relapse doesn't respond well to initial treatment, it signals the need for closer monitoring and possibly changing the long-term management plan. Sometimes a relapse occurs even when someone is on medication. This could mean the treatment isn't fully effective or that the person isn't taking the medication as prescribed. Evaluating adherence is crucial because missing doses or stopping medication can mimic treatment failure. If side effects or other issues cause someone to skip doses, switching to a more tolerable medication might help improve adherence and outcomes. It's also important to distinguish a true relapse from a pseudo-relapse, which is a temporary worsening of symptoms caused by factors like infections, heat, or stress. Proper assessment ensures that unnecessary changes aren't made to treatment plans. After a relapse, rehabilitation therapies such as physical, occupational, or speech therapy can help restore function and manage residual symptoms, shaping long-term care strategies. Frequent or unusual relapses might lead doctors to reevaluate the diagnosis, ruling out other conditions that mimic MS. The pattern of relapses and progression helps determine whether the disease remains in a relapsing-remitting phase or is transitioning to a secondary progressive form, which influences treatment choices. Finally, relapses emphasize the importance of patients reporting new symptoms early. Prompt medical attention allows for quick treatment and helps prevent further disability. Regular checkups and imaging studies can also detect disease activity that isn't yet causing symptoms. In essence, each relapse acts as a guide, helping healthcare providers understand how well treatments are working, when to make adjustments, and how to support recovery. By carefully analyzing relapses, clinicians can develop personalized plans that aim to reduce future relapses, slow disease progression, and improve quality of life. Always remember, individual experiences vary, so it's essential to work closely with healthcare professionals to tailor the best management approach for each person.